Hello, thank you for joining us today. In this video, we will be discussing eating disorders and how they play a role in the lives of many college students. First, we will talk about the different types of eating disorders, prevalence in college students, and how to identify symptoms. We will also talk about treatment methods currently used by psychologists and give you tips about how to engage, support, and refer others towards professional treatment. The 4 eating disorders we will be discussing today are anorexia nervosa, bulimia nervosa, binge eating, and eating disorders not otherwise specified. In the United States, approximately 30 million people suffer from an eating disorder during their lifetime. On average, a person dies from an eating disorder every 62 minutes, and though prevalence of reported eating disorders vary by college campus, one study found that less than 10% of students who screen positively for a disorder seek treatment. Allow me to formally introduce myself. My name is Jessie, and I am here to talk to you about one type of eating disorder called anorexia nervosa. Anorexia nervosa is a disorder characterized by abstaining from eating food. Physical symptoms of anorexia include weight loss, fatigue, dizziness, and low blood pressure. Psychological symptoms include dissatisfaction with food, dissatisfaction with body weight and shape, sensitivity to criticism about the body, depression, anxiety or irritability, and low self-esteem. So what is the cause of anorexia? Anorexia may stem from extreme body dissatisfaction or a distorted body image, which are key identifiers for this disorder. For example, someone with distorted body image may see themselves as overweight when in fact they are slender. Anorexia may also occur when someone feels out of control of their life and situations around them. Guilt, shame, or self-loathing may be experienced, particularly regarding one's body. If someone in your life displays signs of anorexia nervosa, here are a few tips. Avoid accusational questions such as, "You're not eating, are you starving yourself?" Instead, offer support such as, "I am concerned for your health. Is there a way that I can help?" If someone confides in you that they are struggling with anorexia, acknowledge their steps towards recovery instead of pointing out negatives. This positive approach will be more beneficial for both their recovery and for the well-being of your friendship.
Another eating disorder is binge eating disorder. Binge eating disorder is when a person has recurring episodes of eating unusual large amounts of food in a very short period of time, especially beyond the point of being comfortably full, but does not use extreme weight loss strategies. Some of the personal characteristics of a person with binge eating disorder are low self-esteem, perfectionism, anxiety, and obesity. Some of the symptoms are eating until feeling comfortably full, eating alone because embarrassed, feeling guilty, depressed, shame of oneself, engaging in binge eating episodes, and these binging behaviors are without purging. So, what you could do to help someone out with binge eating disorder is simply be supportive, be non-judgmental, and be there and inform about professionals that could help. Other treatment options are cognitive behavioral therapy, which is the most effective treatment for binge eating, adaptive coping strategies. Also, it seems to help to read self-help books that focus on CBT, cognitive behavioral therapy. It's important to know about the signs and the symptoms so you could help out people or recognize the symptoms in oneself.
Another common eating disorder is bulimia nervosa. Bulimia nervosa affects 1.5% of females and 0.5% of males in the United States. Bulimia nervosa is characterized by episodes of binge eating, which is consuming a large amount of food in one sitting, followed by purging, which is self-inflicted vomiting. Many bulimics are of average weight or overweight. Symptoms of bulimia are the following: frequently eating alone and spending excessive time in the bathroom, being overly obsessed with body image, especially having an extreme fear of gaining weight, and deteriorating tooth enamel from purging, and broken blood vessels on the face from purging as well. Bulimia nervosa can stem from various sources, such as a stressful transition or major life change, abuse or trauma, negative body image and poor self-esteem, and professions or activities that focus on appearance. Treatments for bulimia nervosa include therapy, which can be CBT, support groups, family therapy, or psychotherapy. Medication is another form of treatment, and in severe cases, even hospitalization. Specialists are a very common form of treatment, whether it's a dietitian, nutritionist, or psychiatrist. And finally, an important treatment to maintain is self-care.
Lastly, we will discuss other specified feeding or eating disorder. It is characterized by causing significant distress but not meeting the full criteria for another eating or feeding disorder. This disorder was previously known as eating disorder not otherwise specified. Some examples of this disorder include atypical anorexia nervosa, where weight is not below normal, bulimia nervosa, with less frequent behaviors, binge eating disorder, with less frequent occurrences, purging disorder, purging without binge eating, and lastly, night eating syndrome, excessive nighttime food consumption. The symptoms of this disorder are very similar to anorexia, bulimia, and binge eating disorder, which includes a loss of control of eating behaviors, body dysmorphic disorder, and mood disorders such as depression, anxiety, and suicidal ideation. The most common treatments for this disorder include cognitive behavioral therapy, interpersonal therapy, dialectal behavior therapy, nutritional counseling, and support from friends and family.
Eating disorders are common amongst college students. It could either be anorexia nervosa, bulimia nervosa, binge eating, or eating disorder not otherwise specified. Great source we have in college is the Personal Growth and Counseling Center, the PGCC. We could call them at 831-582-3969 and Building 80.